Hello, this is Dr. Rajat Jangir. I'm consultant orthopedic surgeon at Shoulder Knee Surgery Clinic, Jaipur, and professor at Mahatma Gandhi Hospital, Jaipur. I'm specialized in orthopedic surgery related to shoulder and knee surgery, especially arthroscopy, joint replacement, and sports injuries between musculoskeletal pain and physical activity. So, musculoskeletal health, it refers to proper functioning of muscle, joints, and bone without pain. And people with good musculoskeletal health can carry out various activity with greater ease and without any discomfort. A weakened musculoskeletal system, it can lead to societal, psychological, adverse physical outcomes, particularly in elderly populations. Impaired musculoskeletal health can cause acute and chronic pain in muscle, bones, joints, and it leads to physical restrictions, loss of participations, and withdrawal from day-to-day social, communal, and occupational activities. This drifts an individual towards isolation, disrupting his social well-being, affecting his mental health, and degrading his overall quality of life. Several epidemiological studies that has revealed that interconnection between musculoskeletal health and physical ability of an individual. An individual will with an arthritis or a musculoskeletal disorder is sure to be less active than an individual without arthritis or a musculoskeletal pain or a poor bone health. Similarly, a person following an inactive or a sedentary lifestyle is more prone to get a musculoskeletal ailment. Painful musculoskeletal conditions leads to a lack of physical activity and cause functional decline. Third, they leads to fertility, depression, reduce independence, and they leads to overall less well-being. Impaired musculoskeletal health impairs the gross motor and fine motor capabilities like gripping power, limb strength, walking speed, etc. Often individual leading to several clinical manifestations that require prolonged medication or a surgical support. Thus, a regular fitness regimen should be followed by everyone, regardless of age, sex, or medical condition, to lead a healthy and happy life. There are several steps that you can take to optimize your bone health and your musculoskeletal health. First step is to start with a good nutrition. Get adequate amount of calcium, vitamin D, vitamin K, and vitamin C. Calcium can be taken with the milk, dairy products, nuts, and high protein diet. Vitamin D can be taken by taking a sun bath. Vitamin K with green leafy vegetables. Vitamin C with the citrus fruits. Second step is to maintain overall healthy lifestyle. Eating disorder like binge eating or obesity, smoking, depression, that all contributes to bone weakening and leads to increased osteoporosis that you need to avoid. The next step is to engage in weight-bearing physical activities. Weight-bearing physical activities benefits includes increased bone mass, increased muscle mass, muscle strength, improved function, delayed loss of independence, improved quality of life, decreased risk of fall. The next very important step is to prevent fall in elderly people, especially muscle strengthening, balance training, a regular Tai Chi program, removal of home hazards like rugs and cluttering at home, elimination of psychiatric medications whenever possible, and use of a multidisciplinary program to assess and evaluate all the risk factor that leads to fall in elderly population. The next step is to encourage regular visit to a physician when you are at risk of developing osteoporosis or a weak bone health. Those risk factors are female gender, increased age, estrogen deficiency, low BMI, that is low body weight, family history of osteoporosis, smoking, or a prior history of osteoporosis or a prior fracture. DEXA is the dual energy X-ray absorptiometry. This is the test for diagnosis of osteoporosis. There are several methods that can prevent osteoporosis that we have already described, and regular physical activity is always a must. Thank you. Thanks for your patient hearing.